Americans are confused, frustrated, and asking one question: are vaccines really still available? What you're about to see is a fiery showdown that explains why this matters for every household in the country.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, "If vaccines are working for somebody, I'm not going to take them away." No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise,
I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm
she
not
was
surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I
you.
was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
What we just witnessed between Senator Elizabeth Warren and Secretary Robert F. Kennedy Jr. was not just a political clash, it was a vivid demonstration of the tension that exists at the intersection of public health, government accountability, and individual access to medical care. At its core, this hearing wasn't simply about a COVID-19 booster, it was about trust, transparency, and how policy decisions directly impact the health of millions of Americans. Senator Warren confronted Kennedy with a very direct challenge. Last November, he promised during his confirmation that he would not take vaccines away from anyone who wanted them, no exceptions. Yet, in the past week, HHS adjusted its guidance, stating that the COVID-19 vaccine is no longer recommended for healthy adults under 65. While the vaccine technically remains available, the change in recommendation triggers practical consequences. Insurers may no longer cover the cost. Pharmacies may restrict access, and in some states, legal and procedural barriers can prevent people from receiving the vaccine easily. This distinction is crucial for viewers to understand. In U.S. healthcare policy, availability and recommendation are not the same thing. A product can exist, but if it's no longer recommended, access effectively diminishes, especially for the average person who relies on pharmacies and insurance coverage to get care. This is where Warren's questioning hits the heart of the matter. It's not just about semantics. It's about real-world access and the public's perception of fairness and trust. The exchange also highlighted concerns about conflicts of interest. Warren pressed Kennedy on the $855,000 he received from pharmaceutical companies, framing the policy shift as potentially influenced by financial considerations. Kennedy countered by emphasizing his role in following scientific evidence and data, maintaining that recommendations are based on clinical studies rather than political or financial pressure. This back and forth illustrates a broader challenge in public health leadership: how to maintain public trust when decisions are scrutinized through both a political and ethical lens. This hearing also sheds light on concerns about conflicts of interest. Warren pressed Kennedy on the $855,000 he received from pharmaceutical companies, framing the policy shift as potentially influenced by financial considerations. Kennedy countered by emphasizing his role in following scientific evidence and data, maintaining that recommendations are based on clinical studies rather than political or financial pressure. This back and forth illustrates a broader challenge in public health leadership: how to maintain public trust when decisions are scrutinized through both a political and ethical lens. This hearing also sheds light on how policy messaging can impact public behavior. When a federal agency moves from a universal recommendation to a selective recommendation, even if the vaccine is technically available, it changes how the public perceives risk, necessity, and accessibility. People may assume the vaccine is taken away or unnecessary, which can influence vaccination rates and public confidence in health institutions. For policymakers, the challenge is balancing scientific rigor with clear, accessible communication to ensure that the public understands what is and isn't being restricted. Another layer to this debate involves the broader implications for healthcare governance. Kennedy defended his actions by citing the absence of sufficient clinical data for certain groups, arguing that endorsing a product without evidence would be irresponsible. This introduces an important principle in public health. Recommendations must be evidence-based, even when they clash with prior promises or public expectations. It's a delicate balance, protecting the public from misinformation while also ensuring access and honoring commitments. Ultimately, this confrontation is a microcosm of larger societal tensions. Americans are navigating complex information environments where policy, politics, and science collide. Hearings like this are crucial because they expose these conflicts, allowing the public to see how decisions are made and understand the rationale behind them, beyond the headlines and soundbites. They also remind us that accountability in leadership is about transparency, consistency, and communicating the nuances of policy clearly. For viewers, the key takeaway is that public health decisions are rarely simple or one-dimensional. They involve trade-offs between evidence, access, and ethical responsibility. This hearing offers a rare inside look at how those trade-offs are debated in real time, giving us the tools to critically evaluate the policies that affect our communities and our families. If you want more breakdowns like this, where we cut through the political noise and explain exactly what policies mean for you and your family, make sure to subscribe to Left Lens. We don't just show you what happened, we help you understand why it matters and how it shapes your daily life, your health, and your rights as an American.